Now, the Ministry of Health is warning that the number of patients needing hospitalization could soon overrun available facilities. The Ministry of Health also announced that another 25 people had passed on as a result of COVID-19 related complications, with the positivity rate remaining at a high of 22%. And as Dorcas Wangira now reports, the Doctors' Union too is alarmed by the increasingly acute shortage of health workers in the country.
Just days into what is now recognized as the third wave of COVID-19, Kenya is at a tipping point. A rising number of infections is overwhelming an already stretched healthcare system, and the lack of adequate ICU units and personnel to handle severe COVID-19 cases is now a matter of life and death. In the last 24 hours, 25 deaths have been recorded, 3 in the last 24 hours, and 22 being late death reports. This brings Kenya's cumulative fatalities to 2,048. 1,127 people have tested positive, bringing Kenya's caseload to 123,167. The sample size being 5,393. The test positivity rate was 22.1% for the second consecutive day. And according to the Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU, the counties are the weakest link to the COVID-19 response.
Even as you're talking about expanding and building ICU spaces or increasing the ICU capacity, there is no adequate personnel, doctors, nurses, who work in critical care units. The rising number of infections has not spared the healthcare workers.
Services in our health facilities are stretched out, but may I say, not quite overrun. All our medical teams and health facilities have been advised to be on high alert and care for our people who need any medical attention.
10 doctors are currently admitted in various health facilities across the country. The union urging the Ministry of Health to fast-track the contract renewal process of the 156 healthcare workers hired to work in isolation and treatment centers across the country.
COVID-19 testing levels have not been adequate, and some counties are waiting up to 5 days to get COVID-19 results. 5 days. Lack of testing puts contacts of patients with COVID-19 at risk of contracting the illness, and isolation is also decreased.
1,090 patients are admitted in different health facilities and 3,224 are in home-based care. 135 patients are admitted in ICU, a sharp increase with 15 being newly admitted.
Do not take lightly the fact that there is no ICU space, the fact that isolation wards are getting full in record days. That would mean that most will lack access to healthcare.
I wish to remind our healthcare providers, both private and public, that we are in a pandemic. And this being the case, it is not the time to punish our people through some self-seeking, money-minting, opportunistic escapades. It is better to save lives than carry the curse of millions of shillings made at the altar of sacrificing our people's health.
To support COVID-19 containment measures, the Kenyatta National Hospital is now scaling down all elective surgical procedures. Even though emergency surgeries will continue uninterrupted, stable patients will be discharged for continued care as outpatients in the nearest facility. Patients in the wards will be reduced and all outpatient clinics will be scaled down. Dorcas Wangira, Citizen TV, Nairobi.